This is a skill drawing up medications from vials or ampules. First, complete all of the medication guidelines, including the 3 checks against the MAR, identifying the patient with 2 identifiers, and educating the patient about medications. Complete the 6 essential tasks. To draw up medications from vials, mix the solution in the vial by rolling in between the hands, if necessary for the medication. Place the vial on a flat working surface. Scrub the rubber top with an alcohol wipe. Ensure that you are using a blunt needle, aka a vial access device or a VAD, and attach that needle to the syringe that you will be using. A blunt needle is one that is used only to draw up medications, not to administer the medication. Draw air into the syringe that is equal to the amount of medication that needs to be withdrawn from the vial. Remove the cap of the blunt needle carefully. Place this on a clean surface. Insert the blunt needle into the vial at a 90-degree angle while maintaining sterile technique. Inject the air from the syringe into the vial with the tip of the blunt needle above the fluid line. Invert the vial, keeping the needle vertical to the medication. Slowly drop the medication to the ordered amount. Keeping the needle in the vial, remove any air from the syringe by injecting the air back into the vial. If there are air bubbles, carefully tap the syringe, pushing the air towards the top. Once the air is at the top of the syringe, push remaining air into the vial and ensure that the medication that is in the syringe is still the same amount that is ordered. If not, draw more medication back. When the dose is correct, withdraw the needle at a 90-degree angle. Hold the syringe upright at eye level to recheck the medication dose. Recap the blunt needle using the one-handed method. Remove the attached blunt needle and replace with the proper needle needed for medication administration, being sure not to break sterile technique. Properly dispose of the vial and blunt needle in the sharps container. Next is drawing up from ampules. Gently flick or tap the top of the ampule to make sure that all the medication that might be trapped at the top of the ampule moves to the bottom. Using an ampule snapper or 2x2-inch gauze pad, break the top of the ampule, making sure to break it away from you. Attach the filter needle to the syringe. A filter needle is needed anytime you are working with glass. Inject the medication from the vial using one of 2 methods. For both of these methods, you will not inject air. One method is to invert the ampule, then place the needle in the liquid, withdrawing the medication. The other method is to hold the ampule in one hand and place the needle in the ampule, withdrawing the medication. After removing the filter needle from the ampule, hold the syringe vertically and draw back 0.2 milliliters of air into the syringe. Remove the filter needle and reattach the needle that is needed to be used for medication administration. Once the correct needle is attached, eject the 0.2 milliliters of air and read the dose. Make sure that this dose is still the amount needed for the medication administration. Dispose of the ampule pieces and filter needle into the sharps container. Document the administration of this medication and complete your ending 4.